Is that a tasty leaf? I'm so happy it was so tasty. Hey everybody, and welcome back to our channel, The Urban Bunny. My name is Michelle, and this is my bunny, Sudoku, but we call him Sue for short. I don't know if you can see him. So anyways, a few weeks ago, I had to get Sue's back molars filed down for the first time in his entire life. He is a 7-year-old bunny, and that's why today I'm doing a video on rabbit dental issues, so that other rabbit owners can be aware of rabbit dental issues. Because if dental issues go unknown or are not treated, it can actually make your rabbit ill. So rabbit dental issues are not uncommon in rabbits, and they can definitely be time consuming with aftercare and visits to the vet after having the procedure done, and they can cost money. I'm not new to dental issues. I've had rabbits before that experienced them, and once a rabbit has a dental issue, they'll always have a dental issue. So dental issues are very complicated in rabbits because adult rabbits have 28 teeth that continuously grow. They have, I'm just watching him right now. Come here, boy. They have 4 incisors in the front, 2 on the top, 2 on the bottom, and 2 peg teeth behind the 2 front incisors. And what rabbits' incisors are used for is, they act like scissors, so they cut away, they help cut leafy greens or chewing on chew toys, and then later on, after they cut whatever they're eating, it passes down to their cheek teeth, which are their premolars and their molars. And what the cheek teeth do is they help to grind down the food before the rabbit swallows the food. There's different types of dental issues that rabbits can deal with, and they can get complex. One is overgrown incisors. That's where the bottom teeth grow over top of the top teeth, or they grow out sideways. And with overgrown front teeth, the procedure would be having those teeth filed down. And with that procedure, the rabbit would have to be sedated. Now, if they're having problems with their front teeth, they may have problems with their back teeth as well being overgrown. And this could be a result of just genetics or not having a proper diet where they have enough hay in their diet, like corset hay, like Timothy hay or oat hay. So it's important that your rabbit has a balanced diet where they have that fiber. Not only is it going to help with their digestive tract, but it may help wear down their back teeth. Another one, as I was just talking about, was overgrown back molars. Now, again, that could be due to age or due to misaligned teeth, malocclusions, and again, they would have to go in and sedate the rabbit and file the rabbit's teeth down. Abscess teeth is another dental issue that rabbits can suffer from, and it's very complicated. Now, if you catch it in the early stages before it develops a pustule, they may be able to treat the infection with antibiotics, but there's no guarantees. If it does develop a pustule, they may suggest taking the tooth out, but again, after that, more abscess teeth can form, and it's a very complicated dental disease, and it's very time consuming. I had a rabbit that had abscess teeth, and I had to take her back to the vet once a week for 4 weeks to have where they pulled the tooth out cleaned out, and she had to have medication afterwards. And then she was on medication for the rest of her life, and then more abscess teeth did form. So it's a very complicated disease, and it's very time consuming. So what are some signs that your rabbit has dental issues? Well, some signs that you can catch before it gets worse is if you see saliva in their water dish, if they have a wet nose, I mean, if you can get close enough to your rabbit to inspect them, if they have discharge, out of their nose or eyes, that's another one. If they're having a hard time chewing or they're dropping their food. If they are hunched over, that's another one. And if they're not eating the same amount of food and they're losing weight, that's another sign. If you can get close enough to your rabbit, if you can smell bad breath, that's another sign. So those are just a few signs to look for. And you can also check your rabbit's face too to see if there's any bumps or lumps happening, if you have a rabbit that will allow you to do this. Some rabbits won't allow you to touch them. They don't like being pet. So what are some preventatives that you can take to ensure that your rabbit isn't suffering from dental issues? Well, you can take your rabbit to a rabbit savvy vet for a yearly checkup, or you can go twice a year, and the vet will inspect your rabbit's mouth to see if there's anything abnormal going on or something different. Chew toys is another one. I prefer to give my rabbit wooden toys over cardboard. I do let them chew on cardboard, but wooden toys will help with their front teeth being worn down. And I give him other toys like this toy here, which has seagrass on it and vine. This will help with his front teeth being worn down, and the seagrass will help with his back teeth being worn down. And another preventative is giving your rabbit hay, coarser hays like oat hay and Timothy hay. It's coarser, so it will help with the grinding action with their back teeth. Talking about teeth is not my favorite thing, because as a rabbit owner, I've dealt with a lot of teeth issues, and as I said, they can be time-consuming and costly. And you know, sometimes when you go to the vet will suggest other things like getting an x-ray done or blood work to determine what is causing the issue with your rabbit having teeth problems. So that concludes our video for today. Teeth issues are not my favorite thing to talk about because I've dealt with a lot of teeth issues. So if you liked this video, make sure to like, and if you want more videos, make sure to subscribe and hit the bell to be updated. So I thank you for watching, and this is a bad pun, but everybody have a bunnyful day. Thank you for watching.